Welcome to Unstitching ADHD Urban Ed Talks. I'm your host, Dr. Stanley Ekiyor. In the last episode, we examined recent findings on medication and preschoolers. Today, we will explore a critical conversation about treatment approaches for ADHD, looking beyond medication to a more holistic and multimodal approach. Now, let's be clear. Medication has proven to be highly effective in reducing ADHD symptoms. Most recent research reminds us that medication alone isn't enough. ADHD is not just about attention and hyperactivity. It's about the ripple effects on school performance, family relationships, self-esteem, and often comorbid conditions like anxiety and learning difficulties. So what does this mean for treatment? It means we need to identify clear target outcomes for each child or adolescent. For one student, the priority might be reducing disruptive behavior in the classroom. For another, it could be improving reading skills or rebuilding confidence. A one-size-fits-it-all, plain simple, doesn't work. We have experimented that for too long. We cannot continue on the same path and expect a different result. According to Albert Einstein, and I paraphrase here, it's the classic definition of insanity. So that's where multimodal interventions come in. This could include behavior therapy, academic support, parent training, counseling, or social skills training. And here is the key. The individual's need dictate which professionals get involved, whether that's educators, psychologists, physicians, or family therapists. It's also important to recognize that ADHD is one of the most extensively studied disorders. High-quality research consistently validates its existence and shows the significant challenges it brings to social, emotional, and educational development. So we're not making stuff up. Children and adolescents with ADHD are at high risk for setbacks in all these areas if left untreated. But here's the problem though. Despite all this evidence, studies out of Brazil reveal that nearly 95% of children with ADHD do not receive treatment. Let's let that sink in for a moment. Think about it. 95%. And this isn't just Brazil issue. Globally, stigma, misconceptions, and the lack of adequate training among professionals continue to block children from accessing the help they need. So while medication is a powerful tool, we must push for comprehensive, evidence-based, and individualized care. And we must also fight stigma with knowledge, advocacy, and compassion. That's all for today's episode of Unstitching ADHD Urban Ed Talks. Remember, treating ADHD is not just about managing symptoms. It's about unlocking potentials, building confidence, and creating an environment where every child can thrive. I'm Dr. Stanley Ekiyor. Thanks for listening. If you find this helpful, please continue this conversation. Let's unstitch the complexities of ADHD one stitch at a time. And share with a colleague, a friend, a parent, and don't forget to subscribe for more conversations at the intersection of research, practice, and real-world impact. And if you have a story to share, reach out to us. We'll be very, very happy to give you a platform in Unstitching ADHD Urban Ed Talks. To learn more strategies, please visit www.warebiassociates.com, or tune into Unstitching ADHD Urban Ed Talks with Dr. Stanley Ekiyor, available on all major podcast platforms and YouTube. Remember, the sun is behind the clouds. It will always shine.